Hi, my name is Dr. John Matthew.
And I'm Megg.
We are from the Slippery Rock University Student Counseling Center, and today we're going to talk about suicide prevention. So if you didn't know, September is National Suicide Prevention Month. So it's a great time to review your mental health services on SRU campus. So I just want to give a quick little stats about suicide on college campuses. Suicide is the second most common cause of death among college students. And more than half of college students have had suicidal thoughts, and 10% think seriously considering attempting suicide.
So how can you help? We want to talk to you briefly today about 4 main points of your role and how you can help prevent suicide. And those are identifying signs, fostering connectedness, encouraging help seeking, and knowing the resources.
Some key terms for you to know is warning signs. It means it indicates an immediate risk of suicide. Risk factors, as we'll talk about, are characteristics that make it more likely that an individual will consider, attempt, or die by suicide. And protective factors, which are characteristics that make it less likely that individuals will consider, attempt, or die by suicide.
So some examples of some warning signs, talking about wanting to die or killing yourself, feeling like you're a burden to others, acting anxious, sleeping too little or too much, withdrawing.
Some risk factors, if there's any underlying mental health disorders, especially mood disorders, schizophrenia, anxiety, or other personality disorders, substance abuse, alcohol or other drugs, if someone is feeling hopeless, if there's any family history, and also, if you start seeing, lack of health care, things of that, especially the mental health and substance abuse treatment.
And then some examples of protective factors, having contact with providers, seeing a counselor, connection to groups of people. So having a solid group of friends, strong family support, religious beliefs, things like that. And we're going to have this information available on our blog as well. I know we briefly kind of went through this, but if you want to take some more time to look at some of these, we'll have that available for you.
So a thing that we want to talk about is staying connected and encouraging help seeking, right? And so a strong connections to individuals, family, community, and the social institutions we have, they provide that purpose and meaning that we want, right? Involvement creates multiple points of supportive contact.
So what can you do? You can ask your friends specifically how they're doing. You want to open up those lines of communication and not be afraid to ask directly about suicidal thoughts. It's sometimes a misconception that if you bring it up, you'll put the idea in somebody's head. But a lot of times, if somebody's already considering suicide, it can be a relief for them to hear a friend say it and to know that those thoughts don't scare you. And then also encourage communication with campus faculty and staff. Understanding that you may not have all the answers, but being able to reach out to or encourage your friend to reach out to somebody on campus who knows the resources and is able to kind of better help them.
These are some resources that we want students to have. I'm going to go over briefly what we have on campus that we use a lot. So for one, the Student Counseling Center, where I and Megg both work. Our phone number is here with our email address if there's something that you would have a question about or if you want to get into services. And I'm also going to differentiate between Student Counseling Centers, student support, and student health services. So student support is somewhere where you would put a care referral in, and that would go to somebody in that office, and they would reach out to that person that you feel needs help or they're asking for help, and they will check in and tie to the resources such as a student counseling center or a student health center. The student health center services, the number is below. The student counseling center is open Monday through Friday. On Mondays and Tuesdays, we're open from 10 to 6:30 p.m. And on Wednesday through Friday, we are open 8 a.m. to 4:30 p.m.
So for more immediate needs, if you have concern for a student's immediate safety, your first call is going to be to University Police or to 911. So that phone number is on there for you. Another resource to use is Center for Community Resources, which is Butler County's crisis line. So they're 24/7. You can give them a call if you have a concern for a friend, or if you just need to talk yourself. And then also the National Suicide Prevention Lifeline, which is the 1-800 number, the suicide hotline. That's also 24 hours a day, 7 days a week, that you can use. You can call as a resource for yourself or for a friend as well.
We would like to thank everybody for tuning in. Please remember to check out our YouTube. There's a variety of videos. And also we will have the links to this resource that you could use. And also check out our blog. We'll have those linked together as well. And we were happy to get to speak to everybody. Thank you.
Thank you.